Hi, everyone. This is Dawn Rudolph, working with the Association of University Centers on Disabilities, and I'm very pleased to welcome everyone to the inaugural AIR-P Research Day at Autism CARES. I'll cover just a very quick housekeeping slide before we get started. The meeting is being recorded and will be archived online. Closed captioning is available. You can look for the little CC button at the bottom of, Zoom control panel. All the participants who are not presenters will be muted and have their videos turned off throughout the meeting. You are very much encouraged to use the chat box for comments and for questions. You will periodically throughout the meeting see images of monuments and memorials in Washington, D.C. Those are there for two purposes. One, to alert the speakers that they have about 30 seconds left in their presentation. So it's in part an attempt to help us keep on time throughout the meeting, but also in part a reminder of when we will be able to travel again. These are the fun things you'll get to see in Washington, D.C. in the future. And then the last thing I want to mention is at the very end of the meeting, there will be an evaluation survey available on the screen and in the chat box, and we will encourage you to give us your feedback because we want to honor your feedback and improve this for the future. And that is all I wanted to share, and now I am very happy to turn this over to Alice Kuo, who is the PI of AIR-P, Professor-in-Chief of UCLA Medicine MedPeds, and the Director of the UC Len program. Welcome, Alice.
Thank you very much. Thank you for having me. I am so thrilled to be hosting this inaugural event, and thank you and welcome to everyone who has joined us for an exciting half day on autism research on physical health. I wanted to give a brief overview of the ARP, as we call it. This is a new iteration of this project, and we have done some things in the last 10 months that we find exciting and we wanted to share with you. Next slide, please. So this is the official HRSA acknowledgement. The ARP is funded from the Maternal and Child Health Bureau using Autism CARES dollars. The MCHB is at HRSA, and this is the information. Next slide, please. So what we're hoping to accomplish with the ARP is a new wave of autism research. Many of you may be aware that hundreds of millions of dollars have been poured into autism research over the past couple of decades. And the vast majority, 85%, has really focused on early intervention before the age 3 and biological markers of the condition. And that has been wonderful in the past and has really promoted the field of basic science research and behavioral and interventional research. But now comes the need, I believe, and what we are trying to do in ARP to improve the lives of autistic individuals. Our goal is to develop this field of autism physical health research, and our strategy is to create a new cadre of researchers dedicated to improving the lives of autistic individuals. I won't go into the details about all the different components of ARP because there's a whole webinar on that, and feel free to look at our website for those types of details. I think what I really wanted to impart was the recognition that autistic individuals are a minority in society like other minoritized groups. So similar to individuals who have different racial ethnic backgrounds, gender identity and gender and sexual health minority individuals, and other disabled groups, disabled individuals. All of these different types of people are the fabric of our society, and autistic individuals, I think, are increasingly recognized for their strengths, for their characteristics, and for their contribution, honestly, and we need that level of diversity throughout all aspects of our society in order to survive and to thrive. And is that fundamental belief that really undergirds everything that we do at ARP, and recognizing that we have new and interesting research questions to explore in order to improve the lives of autistic individuals. Next slide, please. And so what are we researching? And these aren't necessarily the kind of common or frequent types of topics that you think of when you go to an autistic research meeting or a research meeting on autism. Looking at primary care services for autistic individuals and hoping that some of those services will also translate to non-autistic individuals. And so the first example is a great example of that, addressing needle anxiety. This has been an important intervention that we have developed, especially in light of the COVID-19 vaccine and trying to get all populations who are vulnerable to the disease to get the vaccine. Often needle anxiety can be a challenge or an obstacle. However, autistic individuals are not unique in this. 10% of the population has needle anxiety. Developing that intervention here in ARP will improve healthcare for everyone. And so that is sort of the theme of how we'd like to view research on autism physical health. Community-based lifestyle interventions, diet and exercise, nutritional support, increasing physical activity. These are all interventions that are important to the autistic population, but to everyone as well. Understanding how autistic women feel when they're pregnant. I think people don't think that autistic people get pregnant, and yet they do, and they have, and we really don't have any sense of the outcomes of those pregnancies, the experience, how we can make the experience of pregnancy better, so that the autistic woman feels empowered as a pregnant woman and then also as a mother. These are all very important research questions that are, I think, an opportunity to really build out as a research field. Looking at health services and systems, this is where a lot of equity work is being done, and identity work and population level work. And then more sort of traditional physical aspects of health, neurology and genetics for understandable reasons. And we have some exciting presentations, especially in genetics, that I hope you'll stay around for at the end of the day today. Next slide, please. Ultimately, this is what I call the money slide. In order to create the next generation of autism researchers, we've launched an ARP Scholars Program, and our goal is to provide the research support, the mentorship and training, and opportunities for publishing and presenting that will launch this new cadre of ARP scholars to be the next generation of autism researchers. We have finished our year one cycle. We have our first cohort of ARP scholars. We are getting ready to launch cohort 2. So stay tuned. Very soon, in a few weeks, there will be information. So I invite you to check back on our website, and obviously AUCD will promote the Scholars Program when it is available. Next slide. And this is how to stay connected with us. We are increasing our social media presence. We want autistic individuals, autistic friends, autistic researchers to join us and stay in tune and communicate with us. Let us know what you think the important priorities are in physical health, in improving the lives of autistic individuals. We welcome input and feedback, and we really want to be as inclusive as possible as we move forward together to promote this new field. Next slide. So without further ado, I'd like to introduce the 3 program officers that have been really supporting us in true partnership from HRSA, from the Maternal and Child Health Bureau, in our very ambitious plan, I think, to promote autism physical health research. Dana Foney, Eva Assing-Murray, and Jessica DeBerry now have a few words to share with the group.
Thank you, Alice. And good day, everyone. My name is Dana Foney. I'm a health scientist and projects officer within the Division of Research in the Office of Epidemiology and Research at the Maternal and Child Health Bureau. I'm joined today by my colleagues, Dr. Eva Assing-Murray and Dr. Jessica DeBerry. And we are the federal project officers that support the network, as Alice mentioned. And we are welcoming Eva as a new AIR-P project officer, as Dr. DeBerry will soon be transitioning from the project. But we do bring you greetings on behalf of Dr. Michael Kogan, the Director of the Office of Epidemiology and Research, and Dr. Ray Lee, the Director of the Division of Research. Next slide, please. So just briefly, the Health Resources and Services Administration, or HRSA, is an agency of the U.S. Department of Health and Human Services. It's the primary federal agency that's focused on improving healthcare for geographically isolated, economically, or medically vulnerable population. So HRSA programs assist those in need of high quality primary healthcare, people living with HIV/AIDS, pregnant women and mothers, as well as the training of health professionals. So tens of millions of Americans receive quality, affordable healthcare and other services through HRSA's 90+ programs and more than 3,000 grantees. Next slide. So MCHB's mission is to improve the health and well-being of America's mothers, children, and families. We envision an America where all mothers, children, and families are thriving and reach their full potential. And our programs serve more than 50 million women, children, and families each year, including half of all pregnant women and a third of all infants and children in the country. And our programs rely upon evidence-based strategies and are data-driven. Next slide, please. So our Division of Research administers 4 broad grant competitions that include the Research Network Program, the Field Initiated Innovative Research Studies Program, known as the FIRST grants, the Secondary Data Analysis Research Studies Programs, known as SSTAR grants, and the Single Investigator Innovation Program, or SIP. So roughly half of our portfolio has a broad MCH or maternal and child health focus, while the other half is focused on autism. So AIR-P falls under the Autism Research Network grant competition. Next slide. So just a few announcements and updates. So as many of you know, the 2021 Autism CARES meeting is on July 21st. It will bring together our autism-focused grants and cooperative agreements. And this year's meeting will be virtual, and the theme is committing to health equity across the lifespan. And so the AIR-P is one of the research networks in the Autism CARES network. So in terms of our grant awards, we'd also like to, again, and congratulate the AIR-P team led by Dr. Kuo on their award. Their application was described by reviewers and HRSA staff as incredibly innovative. And as Alice mentioned earlier, this is a new wave of autism research. So we've already seen the AIR-P team build a community of collaboration and really tap into some underexplored research areas. And we have several other grant awards, included those listed that were recently competed, that have been either awarded or have applications that are currently under review. And you'll note the Healthy Weight Research Network, another MCHB funded network that AIR-P is highlighting during today's research day. Next slide, please. So as you know, COVID-19 has unfortunately broadened disparities among the vulnerable populations that we serve. So MCHB has incorporated health equity into our strategic plan, as well as into our strategic research issues. So both are evolving and will become publicly available in the very near future. And also to advance health equity, MCHB is committed to better understanding the diversity of the researchers and trainees funded through MCHB grants. So we're asking grantees to provide annual demographic information that will be aggregated across our program so we can really better understand the diversity within our investments. And we're also exploring strategies to increase the diversity of our researchers and better support underrepresented researchers as well as minority serving institutions. And we're continuing to think about performance measurement over time. So what measures can we use to address health equity? For example, within maternal and infant mortality, the timing of prenatal care, the timing of early interventions. So these are just a few MCHB updates that we wanted to share with everyone. And we'd like to again welcome you to the AIR-P Research Day, and we really look forward to ongoing collaborations. I'll now turn it over to Dr. Asing Murray to provide some remarks.
Thank you. Good evening, everyone. And could you go on to the next slide, please? The HRSA reviewer recruitment. We wanted to mention that MCHB is routinely in need of scientific review members with your type of background and expertise. Particularly in the time of COVID, we've become short of available experts who can weigh in on important funding decisions. So please consider lending your time for this effort. And for our research grants that are being competed throughout the year, it's critically important that we identify highly qualified reviewers like yourselves to ensure that we fund high quality proposals. So please contact us if you're interested in serving as a reviewer, and honorarium is provided. Typically, next slide, please. We are in search of reviewers who have a doctorate, who have experience as a PI or experience in the administration of research grants and programs, and who have relevant first authored publications. And our topics vary. So if you're interested, again, please reach out. Next slide, please. Here is our contact information. As Dana said, Jessica Debari is rotating off of this project. So you could reach out to myself, Eva Assing-Murray, or Dana Foney with that, if you're interested. Next slide, please. And finally, thank you for your time and attention today. And thank you to the AIR-P Research Network for putting this meeting together. And we look forward to learning from you all today. And here is our agency contact information as well to learn more about HRSA. This is our website. Thank you again.